This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right, good morning, everyone. I want to talk about peds briefly this morning. Just a quick article is in this month's Journal of Annals of Emergency Medicine. It'll be at the desk here. Come take a look at it if you want. There's some good articles in it. But page 575 this month talks about a big review done across 6 states of pediatric readmissions. So one thing that none of us ever want to hear when we come on shift is, do you remember that kid you sent home the other day? The criteria were kids that were sent home from an emergency department that then were readmitted to the ICU or, unfortunately, God forbid, had a death within 3 days of discharge. And the idea was, what were some trends about those kids that were sent home, and can we learn anything from it? So they looked at over 16 million kids discharged over 6 states over a several year period, and they tried to break it down by age of the kid, by the type of facility where they were seen, a pediatric center versus not, how many kids visits does that center have every year, and then they broke it down by a number of characteristics about the children themselves. So probably the most important outcome from it is they looked at diagnoses of kids who left the emergency department that then came back, and the number one diagnosis was asthma. So 6.5% of these, what are called critical revisits, were in kids who had asthma, who then got home and got worse and came back. Of the top 10 diagnoses for people sent home, 5 of them were respiratory in nature. Other ones include things like appendectomy and sickle cell crisis. The good news is that these are extremely, extremely rare. So thankfully, the vast majority of kids that we send home do fine. In fact, it's 0.1% of all kids sent home even had a critical ED revisit, and 0.00001% of them died. So that's 180 out of 16.3 million, which is almost statistically zero, which is a really good thing. But the 2 major risk factors for going home and bouncing back, so to speak, to the hospital in a critical way are respiratory conditions, namely asthma, and then kids with chronic medical conditions. And there's a common definition for that, but it's things like kids with metabolic syndromes, premature kids, or kids who have chronic medical issues. And thankfully, those are also pretty rare. But those 2 patient populations, we should probably just pay an extra close attention to, make sure we walk the kid and they don't desat, make sure they're not symptomatic, make sure we're addressing parents' concerns and giving them really close return precautions. And most importantly, meaning it when we say to them, if you are worried that your kid isn't getting better, come back. Like one of the familiar refrains for kids is, kids change really quickly, for better and for worse. And they may go home and this febrile illness may be gone, and tomorrow they're running around like crazy and they look amazing. Or it could go the other way too. And if we can honestly just mean that when we say that to the patients and be kind of cognizant of what specific high-risk diagnoses we send kids home with, hopefully we can keep this number as low as it is or even lower. Thanks, everybody.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.